Even if everything has gone right for you and your loved ones, the past year has been grueling. The threat from COVID has waxed and waned, but it's never really gone away. Some of us have to confront it every day. For others, the most basic routines have been totally transformed, and it's not clear if or when normalcy will return. Now, a new study reveals that in the world of higher education, there is intense concern about how the pandemic is affecting college students. A report from the Boston University School of Public Health, the Mary Christie Foundation, and the Healthy Minds Network says nearly 9 in 10 faculty members think student mental health has worsened or gotten significantly worse during the pandemic. Almost 80% of faculty say they've had one-on-one conversations about mental health with students over the past year. But only half of them are confident when it comes to recognizing when a student is in mental or emotional distress. Joining me to talk about the state of mental health on America's college campuses are the study's principal investigator, Dr. Sarah Lipson, an assistant professor of health law policy and management at the BU School of Public Health, Dr. Susanna Gallor, a senior lecturer in psychology at UMass Boston, and Layanie Oscar, a student at that same school. Thank you all for being here.
Thanks for having us. It's wonderful to be with you.
Sarah, let me start with you. These are, to my layperson's eye, really grim numbers. Were you surprised at how grim they are, or did you see this coming?
My team and I, we've been studying mental health in college student populations for about a decade now. So we've seen increasing prevalence rates pretty much every semester for the past 10 years, and in particular for the past 5 years. So I kind of always have to remind myself when I'm sharing the data with folks who haven't looked at them before, just how jarring they can be. And so in fall of 2020, which is our most recent data from student populations, and that was about 33,000 students on campuses across the country, close to 40% of students screened positive for clinically significant symptoms of depression. And so when you step back and think about that is a really jarring number. Adolescents and young adults right now are just really struggling. And I think the pandemic has amplified that in a lot of ways.
Is it possible to say, and this may be a bigger question than you can answer here, but has there been an evolution that has preceded a pace during COVID? Or is there evidence that when it comes to these key metrics that COVID has exacerbated bad trends that already existed?
It seems that the trends, the kind of worsening trends have kind of continued and been mostly kind of at the pace that they were at. But there are some really important risk and protective factors that have been drastically changed by COVID in ways that we can already see in the data. The research that I do is survey research. It's cross-sectional kind of snapshots in time. So we're going to need to continue to collect these data and look at them. But we know that the past 2 semesters of data, we've seen really high rates of loneliness, of isolation, a lack of belonging that college students are saying that they're feeling, heightened levels of financial stress, which is a really important predictor of mental health and particularly of suicide risk. And then really troubling, we know that discrimination is a key factor in well-being and mental health, and there's been an increase in students experiencing discrimination, particularly Asian American and Pacific Islander students, and that's another reason why we're seeing some increases in that particular student group.
Layanie, this is a big ask since we're talking about a whole insane year here, but can you describe, for those of us in this conversation and viewers watching, what the last year has been like for you? What's it felt like to be a student at this bizarre moment and scary moment in history?
It has been completely and utterly grueling. I will say I did feel that sense of isolation, and it was brought up in part by the pandemic and having to move from in-class instructions to at-home instructions. I found myself really gradually, just and then all at once, just isolating from my friends purposefully, because it just didn't feel like that same type of connection at home. But and then to keep that level of connection going over the phone did not seem like something that I could do or willing to do, especially with the stress that was all the stressors of school, of having to quit my job for my mom's health, of keeping up with my schoolwork as well. So I did feel very isolated.
I should mention, you and I talked a little bit yesterday. You had a job that you really, really liked, looked forward to going to, and you had to quit it because your family wanted to protect your mother in particular from COVID, right?
Yes. I had to make the hard decision of, do I want to keep that level of happiness, or do I want my mother safe? And I felt that my mother's health was of greater concern to me than how of going to work just for that interaction with my friends.
Susie Gallor, you have a double perspective here because you are a practitioner of psychology and you teach it to other students at UMass Boston. How have you seen, from those two vantage points, students at UMB weathering the past year?
I actually think it's an interesting question because I've worked primarily up until coming to UMB in more traditional four-year institutions that are residential. And I think the fact that UMB is a very unique kind of campus without it's primarily commuter. There are some students where this has been okay for them because of all the factors that make it really hard under other circumstances, like having 1, 2, 3 jobs, full-time jobs on top of taking classes, living and having family that they're caregivers for. So if anything, having remote classes has been helpful to them. But I think in general, what I am hearing now on the faculty side is that in spite of some of the things that have helped them cope with the pandemic, it's become untenable to manage a full course load. The psychological and emotional toll that this pandemic has taken has, sort of made all of that juggling that they're so competent in doing almost impossible. And so I've heard that from the faculty perspective now for the past several years, and certainly more so this past year. And I was seeing that every year exponentially growing on the other side of it, as you mentioned. I've worked in many different college counseling centers as a staff psychologist, and mental health concerns and distress on college campuses have been growing for the past couple of decades. And I was seeing that then. So I can just imagine college counseling centers this past year. And from what I've heard from my colleagues at UMass Boston, it's been pretty tough.
Susie, pardon me, I said Susie. I should have said Sarah.
That's
Sarah,
okay.
You did a study earlier this year, we're part of a study, that drove home just how prevalent the issues that we're talking about here are. And I think we've got some of the findings ready to pull up for viewers, but I'm going to recap them. In this study that you were part of that came out in February, 83% of students said their mental health had negatively impacted their academic performance in the last month. 2/3 said they were struggling with feelings of isolation and loneliness. Again, incredibly bleak numbers to look at. Can you offer some advice for individual professors who are looking to respond to this sort of thing, and also maybe for institutions that may be trying to figure out how they can equip professors to respond?
Yeah, and I was going to bring in that exact statistic that so many students are saying that their mental health has negatively affected their academic performance. I think that as a faculty member myself, I have had more and more conversations with students about their mental health and about how that's affecting their academic performance. I hesitate in some ways to kind of give advice necessarily for what each faculty member can do. I think there's a lot that we can be doing, and some of it is really low-hanging fruit, kind of bringing in empathy, kind of bringing in a kind of a humanizing lens into teaching. I talked with students last March, and as the pandemic hit, who said that as faculty, started classes on Zoom that they didn't even acknowledge that, the massive changes that had been happening. And so taking a pause before you begin teaching as a faculty member and just acknowledging, the diversity of students in your classes and what they're all going through, as well as what you're going through yourself. I talked with my students in the fall about, I was having a really hard time with sleeping. And I think that's something that a lot of people have really been struggling with throughout the pandemic. And that affects your well-being in really big ways. And so little ways like that of kind of opening up the conversation, I think, mean a lot to students. Faculty can make themselves aware of the resources that are available related to mental health for students on their campus. They can include that information in their syllabus and actually point that information out to students on the first day of class. It's impossible to read through a lengthy syllabus in its entirety, but I always try to, really highlight the mental health services that are available to students at Boston University, where I'm based. And also right now, more than ever, it's important for faculty to be flexible and kind of give that benefit of the doubt to students. If we don't do that, we're risking kind of widening inequalities for students who might be most in need of those, extensions because of any number of extenuating circumstances related to the pandemic. So having that flexibility, giving students the opportunity to really take their time and get their assignments in. And then in terms of what institutions can do to support faculty in this role, so faculty right now are some of the only individuals on campus who are routinely seeing students. So we are therefore uniquely positioned to be able to recognize students in distress. And our recent survey data that you were sharing showed that 80% of faculty have reported having a conversation with students about their mental health, but only half feel confident in recognizing distress. And the majority of faculty said that they are welcoming of additional resources. They want these resources to be brief and online. They want a checklist. They want a kind of guide to have these conversations. So I think there's a lot that these data can tell us in terms of what institutions can deliver to make faculty kind of serve this role more easily.
Susie, what are some of the things that you at UMass Boston have been doing to try to respond to this moment?
I think a lot of what Sarah just mentioned really validates what I've been trying to do and what my colleagues and folks across our campus have tried to reinforce and foster is to really just take a step back and keep in perspective what is happening in the world, and that, giving yourself as a faculty member permission to be more flexible, to make exceptions when you wouldn't typically make exceptions, to establish a connection with students in a way that you might not typically, but perhaps you might continue to do so in the future, where you share a little bit more openly about how hard this is for yourself, but you can imagine for your students, making yourself available and, saying this all as early on as possible. It can go a long way for a student to know that you're okay with them coming to you to just say, I'm struggling. And I think making that explicit as early on as possible could be really helpful. So I tried my best to convey that early on in the semester. I put that in my syllabus. As Sarah mentioned, I actually have a mental health statement in my syllabus that I always have, but it sort of talks a little bit about the stressors that college students, have going on, and that I'm aware of those, and that I welcome them. I welcome students talking to me if they feel comfortable about what's going on, and I will try to support them if I can. And I just think that that sort of establishes a kind of culture in the classroom, and in this case, a Zoom classroom, that could be helpful to students who are struggling, suffering, and don't know what they can do about it or who to talk to about it.
As you talk about those things, I find myself thinking that this could actually be an area in which, coming out of the pandemic, we learned to do something a little bit differently that, in retrospect, we could have been doing differently before. And maybe there's a benefit that comes out of this, having the kind of conversations that you're talking about. Layanie, sure. I want to give you the last word here for a little bit, because you're one of these students that we're talking about. You tried, I know, a couple things to make yourself feel better over the course of the pandemic that didn't work, and then found something that did. Can you just briefly recap that journey of yours?
Of course. In that moment where I was feeling depressed, when I was feeling anxious, and actually found the means to name how I was feeling, I first tried basically keeping myself busy. No moment in time where there was no space in time to feel that. And then I tried counseling, therapy, which was provided for free by UMass Boston. That itself didn't work. And it wasn't until I started my class with Professor Dr. Shirley Tang of the Asian American Studies program, where she was teaching us how to interact with our academic work through healing, storytelling, truth sharing, solidarity, building, and having these conversations in the class space, but also outside of the class space. She made herself available to us. And we practiced every day, every class time, we practiced meditation. We had some time to reflect, to think, to just speak about how we were feeling, like how our bodies were feeling, how we were feeling emotionally, mentally, physically. And I think that was so much better than anything that I had tried prior to that. The ability to have a professor make herself available to you outside of the class space was just, it was wonderful. It was life-changing at that moment in time.
Let me ask you a closing question. In about a minute, what advice would you give professors, parents, fellow students who are, people who are in the orbit of college students like yourself as we hopefully come out of this pandemic?
So your professors are not mind readers, and the students will not tell you everything that's going on outside of the class space. So I feel like building that form of solidarity, that friendship, whereby I can text you outside of the class space, making yourself available, both professors and students, making yourself available to each other to speak about things outside of academics will foster that sense of trust and that ability to talk about how you're feeling, either if you're depressed, if you're anxious. So building that rapport outside of the class space is something I feel we should all be doing.
All right. On that note, Layanie Oscar, Susie Gallor, Sarah Lipson, thank you all for talking about this really important stuff.
Thank you for having me.
Thank you.